Hello, my name is Maimon Anthony. I am a second-year internal medicine resident at Wellington Regional Medical Center. Today, I will be presenting an interesting case of dural arteriovenous fistula masquerading as an incomplete Wallenberg syndrome. Dural AV fistulas are one of the most common types of vascular malformations of the central nervous system. Yet, they are exceedingly difficult to diagnose without a strong clinical suspicion. Etiology remains largely unclear, but it could be due to previous trauma, surgery, or sinus thrombosis. Presenting symptoms are variable depending on the location of the fistula and pattern of venous drainage. Symptoms can include pulsatile tinnitus, visual changes, headaches, seizures, alteration of mental status, and motor or sensory deficits. This often leads to a misdiagnosis of CVA, dementia, seizures, or myelopathy of unknown etiology. If left untreated, symptomatic dural AV fistulas can cause progressive and irreversible neurological deterioration. So today I'm going to present a case of a 50-year-old male who presented to the emergency department with worsening dysphagia, nausea, vomiting, and a sense of disequilibrium since 2 weeks. The patient had similar symptoms approximately 6 to 8 months back, at which time he underwent a stroke evaluation. MRI of the brain with contrast done then showed a 2.5 centimeter lesion in the right brainstem extending from the lower pons to medulla. He was then diagnosed with possible incomplete Wallenberg syndrome. He said that his symptoms have gradually improved since then but did not resolve completely. He now presented due to sudden worsening in his symptoms despite any inciting events. His other past medical history includes diabetes mellitus and hypertension. His vitals were unremarkable. His physical examination showed no deficits except mild right-sided ptosis. His labs were unremarkable. We did a CT head without contrast and it showed a hypodensity within the medulla and lower pons, which was worse compared to previous admission. MRI of the brain showed unremarkable circle of Willis. MRI of the brain showed edematous changes within the medulla, extending into the lower pons, with possible abnormal contrast enhancement within the right medulla. So we consulted neuro-IR, who did a diagnostic cerebral angiogram and confirmed a complex dural AV fistula with multiple feeding vessels. The patient was then transferred to a tertiary care facility for further surgical intervention because of the complexity of his dural AV fistula. On follow-up via phone, the patient said that he has significant improvement in symptoms following intervention. Discussion. Dural AV fistulas are acquired lesions that arise from a formation of low-flow arteriovenous shunts within the dura. The low-flow nature of these shunts cause venous hypertension and congestion to develop over time, and this leads to the eventual arterialization of the vein that drains the fistula, resulting in a decrease in the AV gradient, and this leads to hypoperfusion at the level of the AV fistula. Basic imaging studies like plain CT and MRI brain shows localized edematous changes. Conventional cerebral angiogram is the gold standard for diagnosis. CTA and MRA are also of diagnostic significance but have lower negative predictive value. Treatment should be pursued in symptomatic patients. The options are open surgery, endovascular embolization, or stereotactic radiosurgery. The goal is to obliterate the arterialized vein draining the fistula and hence restore adequate perfusion. Conclusion. Clinical outcomes are heavily dependent on strong clinical suspicion and subsequent intervention. In our case, the patient's stroke-like symptoms, which was waxing and waning in intensity, led us to search for a different etiology. Multidisciplinary approach and communication between various team members, which included the primary team, neuro-IR, neurology, and neurosurgery, were crucial in confirming the diagnosis and prompt treatment, which led to a positive outcome in our patient. Thank you for your time and have a nice day.